Welcome to another episode of What is Hashimoto's with Dr. Martin Rutherford. To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com. And now, here's Dr. Rutherford.
Today is going to be Hashimoto's, should I take medication? And this is a kind of a new one for me, in a sense that the answer previously was different than what I'm going to give you today. I'll kind of encapsulate the entire subject here. So up until now, up until not that long ago, if a person came in here and they weren't on medication, and many of you who seek out alternative cares don't want medication. You know, everyone make medication is bad, and I've never been entirely in that boat. There are different aspects of being ill. There's a very, very acute aspect of being ill in which you get like a significant, overwhelming infection. Sometimes maybe it's good to go get a medication and knock it out, even if it's an antibiotic, and then take a bunch of antibiotics and be done with it. In my opinion, having done this, I've been there. I've tried knocking a lot of infections out with high doses of natural antibiotics and oreganos and these types of things, and it doesn't seem optimum. It seems like when you have an acute flare type of an issue, it seems to me like it might be better to get the medication out of the way, clean up the damage, and then go on with it in a natural flow. And in thyroid, I get the same thing. I get a lot of people come in, I don't want to be on thyroid medication ever, I want to be done, and that's not always possible. If you've watched previous talks that I've done on this, our common procedure was, if you are on a medication, stay on it. We will then modulate what we can. We'll find your triggers. We'll evaluate your case. We'll go through all of the things, the lifestyle, the triggers, the diet, finding stealth pathogens, whatever we have to do to get the immune system under control. And then at that point, you can determine whether you can do the job with herbs and botanicals because everything's been calmed down. Or you can just stay on the medication, because at that point in time, after everything's been to the degree that it can be calmed down, put in remission, then your doctor can dose you much better, and it seemed to be advantageous to do it that way in certain patients. And I would tell people, if you were not on medication when you came here, 60 to 70% of our patients that were not on medication or were on a small amount of medication for less than 2 years, that we could normally, 60, 70% of the time, we could get that person off the medication. That's kind of changed over the last couple of months. There's been a lot of, and this is not going to go across the board in the alternative field, okay? I've affiliated myself for years with people who do research, people who are not just doing research, but also are clinicians who, in other words, they do the research, but they actually treat, and they use these protocols, and then they bring them to those of us who see their data as valuable. And over the last couple of months, my mentor, who was a Dr. Karazian, who is very, very well known for being the person who wrote the book, Why Do I Still Have Thyroid Symptoms and My Lab Tests Are Normal, has come out and not suggested, I would say, when you're evaluating a Hashimoto's case, the TSH is now more important than we thought it was, and that taking a medication to get the TSH under control before you start, if at all possible, helps the alternative practitioner substantially, because it turns out that if you get the right medication, and that is the key, okay? If you get the right medication, that gets your thyroid stimulating hormone down into the functional range, which is 1 to 3, which is a narrower range than on your labs. Then that medication acts as an anti-inflammatory, and it acts as an antioxidant. So the medication itself will now start to dampen inflammation. It'll now start to create an antioxidative stress. Plus, when your hypothyroid is now functioning normally and you're putting out more proper thyroid hormone, it's easier to get your leaky gut fixed. It's hard to get the leaky gut fixed. It's harder to get the leaky gut fixed when your thyroid stimulating hormone is off. When you're in hypothyroid would be a better way of putting it. And that goes for a lot of things. We've talked a lot about how everything slows down. So I've been doing this, and it's been interesting. And I still get the patients that come and go, I don't want any thyroid medication. So I just let them know both sides, and I'll do what they want. Okay, I mean, I don't push it. But I will say that I have seen that the data that Dr. Karazian brought to his last series of seminars on thyroid and autoimmunity appears to be legitimate and useful in clinical practice. Meaning, when somebody comes in here, they're on the right medication, and there's I don't know, 10 or more medications that you can be, and some of them are synthetic, and some of them are natural, and some of them have just T4, and some just have T3, and some have both. And it's a trick. And some of them have, like Synthroid has a ton of ingredients in there that can set off Hashimoto's, like, for example, gluten and red dye and these things. Once you find the right one and you get dialed in, it is unquestionably quicker to get the person through what needs to be done for them, whether it's food sensitivities, whether it's oral tolerance, whether it's their SIBO, whether it's whatever it is. Because now your entire system, you're starting off with your entire system getting the proper thyroid hormone to create the proper energy in their mitochondria, in their cells, to allow their immune system to respond better. All other organs are functioning better. You still may be fatigued, but it's better than if you weren't taking it. The fatigue doesn't seem to be anywhere near as profound, and how that translates is the liver's clearing better, the kidneys are clearing better, the bowels may be moving better, the chemistry is better, and so I'm laying that choice out to my patients. I'm bringing you up to date on the latest data that I'm getting from my colleagues, and I will tell you, I've been around these people for a long time. Dr. Karazian, Dr. Vajdani, several of their colleagues. And my experience has been that when they bring something new to the world, within 3 to 5 years, pretty much everybody's talking about it or writing books and saying that it's theirs. It was their idea. And so I think it's valuable information for you. So if you're on a thyroid medication and your TSHs are off and your doctor gets it down to normal and you're still feeling like crap, I would still stay on that medication until you got an alternative practitioner, functional medicine practitioner, maybe who focuses on Hashimoto's, like me, or one of my colleagues, and knows the steps to walk through. And I think at that point, getting through those steps, you'll find out whether you even needed the thyroid or not. And most of the time, the answer is going to be you probably will. And sometimes it'll be that you won't. But I really think that this first step of doing the thyroid hormone is showing results in my practice and makes logical sense when you think about the chemistry of it. So I'm sure I'm going to get some comments on this one. I welcome that. If you have questions, this is one of the more cornerstone things that a person comes in with, like, I want to get off my thyroid medication. That's what I want to do. And in my world right now, it's about getting your immune system under control, getting it calmed down, getting you back to feeling like a normal human being. By the way, just full disclosure, I take thyroid medication. I had been under care for, oh my God, a long time, and I was doing much better as we picked off every little thing, got the leaky gut, figured out the food sensitivities, but I wasn't on thyroid medication. I was still profoundly tired and having some other symptoms, and there was nowhere else to go with what we knew. Took the medication, finally got it dialed in, and it's good. So I don't take that much medication. I take 25 micrograms of levothyroxine. That doesn't mean that's the right one for you. I take a little teeny bit of liothyronine. Liothyronine, the holy grail of the alternative medical practitioners, the T3. And I take 15 grams of that a day. That's what's right for me. But we were able to figure that out once I got everything else under control. So that's what I understand right now about thyroid hormone replacement therapy. And again, I will reiterate, it seems to be bearing fruit in my practice in people getting better quicker, not having to be seen as much, not having to be seen as frequently. I can't talk about long-term responses yet because I've only been doing it for like 3 or 4 months, but it's been noticeable enough for me to want to do this. Okay, so any questions on that, please shoot them my way. I would be interested to see what your questions might be on that topic because it's a relatively new topic for me, and I'm always open to a perspective that a patient might have that might bring me a little bit more understanding. But that's where I'm at on it. I think that's where you're going to see it's going to be in the alternative world over the next few years, and I hope that's helpful to you.
Thank you for joining us for another episode of What is Hashimoto's? To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com.